Hello!
Hi, what's up?
We are the music therapists at Texas Children's Hospital. I'm Alex.
I'm Michael.
And I'm Mariel.
We're going to tell you a little bit about what it's like to work in the pediatric medical setting.
So, in the pediatric medical setting, some of the goals that we work on include developmental goals. So, how kids can continue learning to be kids while they're hospitalized, learning shapes and colors and numbers. We can work on some of the psychosocial goals. So, body image or any issues that they have with depression, anxiety, mood adjustment, and then rehabilitative goals. So, some of our friends have had injuries and they need to learn how to walk again or talk again or just stretch and move around.
And there are a lot of ways that we do this. We like to call them interventions, but that's when we're using music as a tool to really drive obtaining those goals that Michael just talked about. So, if we're working on a rehabilitative goal and you see us using therapeutic music instruction with a piano or keyboard, we're probably targeting fine motor dexterity and flexibility instead of making them a better piano player. A lot of interventions that we use here are rooted in science. So things like active music engagement, which is a huge umbrella term for music making, means that we are taking specific instances of the music to help increase their attention span, make sure that they stay directed and focused to what's going on. We use melody and rhythm to help drive them in saying maybe the right color of the frog or in helping them target the location that they're throwing the frog to. There are a lot of interventions that we use with kiddos right around 18 months, all the way up to 18 years and beyond. But we do have a special population here in the hospital, specifically in the NICU. So Alex, I was hoping you could talk about both goals and interventions for our babies.
Absolutely. So I serve any of our infants starting at 28 weeks gestation and all the way up until they graduate from the NICU, which will either be going home or moving on to one of our more acute units. So when we're working with babies, we're doing the same thing that we talked about with our older kids. We're working on developmental goals. It's just that we're starting at such a small age that those developmental goals seem really tiny. So maybe we're just trying to get this baby to have a long-term state regulation. They are really, really upset and nothing seems to calm them down. So we're just teaching them how to be a calm baby. And we use infant-directed singing, contingent singing, where what we're singing is relational to what the baby is doing or giving to us. We use instrument play, like guitar play, even putting the guitar in the crib to give them that vibroacoustic sensation. So that helps all manage their state. And once they're able to manage their state, then we can work on those bigger developmental goals like visual tracking and reaching for objects, grasping tiny maracas and different things like that. So we're still working on developmental goals, just on a more small scale. And then we also do the psychosocial goals by embracing caregiver-infant bonding through our interventions, by helping moms and dads sing to baby, helping them interact and learn what the baby is doing and what that means and how to respond best from there on out.
That's so true. Speaking of adults, can you talk a little bit about how we support staff, Michael?
Absolutely. So one of the really cool things that we do here at Texas Children's is we have a staff ukulele choir. So it's comprised of professionals from all over the hospital, doctors, nurses, staff from our IT department who are able to come up to the studio that we have on the 16th floor. That's a fully fledged music studio. And some of them have had no previous musical experience. We're able to teach them how to play the ukulele. We teach them then songs that we can go around the hospital and do care olaying to patients, families, and other staff members, just to bring that sense of community wherever we go.
I know that working in the Children's Hospital, as a parent, hearing us talk about it sounds like an amazing time. And I would say 90% of our job is joyful. It's the happy milestones. It's the really good memories. But 10% of our job is the saddest sad that you could ever sad. And we have the honor of getting to serve patients and their families during end-of-life settings and scenarios. I'm hoping, Alex, you can talk a little bit about how music therapy then goes a step beyond caring for our kiddos and families to also caring for our coworkers and colleagues.
Absolutely. So in a pediatric setting, like she said, this is about 10% of our jobs. It's also 10% of the jobs across the hospital. And so we like to support our colleagues by providing music therapy for our bereaved staff. So they are experiencing these chronic losses. They're experiencing their patient's grief, the family's grief over and over. And so we provide a good grief group that provides music therapy in the form of lyric analysis and then music-assisted relaxation to help them kind of recover, to help them feel a little bit better, give them the opportunity to be acknowledged and to see that other staff are experiencing the same things that they are, to talk through those feelings and what those bring up, and then to help, relax, get to a better baseline so that the next time this comes around, they're able to do it in a really effective way all over again.
What's really cool about Good Grief Group as someone who has gotten to experience and be supported by this intervention is, to me, the group setting. You're getting to work through and find coworkers and colleagues that are sharing similar experiences, and you can help kind of teach and learn and grow from one another. We reflect that in our groups with our kiddos in the hospital. Hopefully, they're not learning how to grieve from one another, but instead, they're learning how to share, take turns. We spend a lot of time helping normalize this environment. It's a very sterile, sometimes scary place to be, and so by embracing holidays and the time of year and what's going on outside of these walls, we get to kind of bring a sense of normalcy and a sense of, I can be like other kids here while we're in the hospital. I think we've talked about everything from tiny to tall and old and everything in between, rehab, development, psychosocial. We're super excited for this opportunity to share with you guys what pediatric music therapy is. Do one of you guys want to step up and tell them the information if they want to reach out?
Yeah, if you have any questions, feel free to email us. The music therapy email will just be musictherapy@texaschildrens.org, and that email will come to all three of us, so we'll be able to answer any questions that you have.
You can also find us by Googling Texas Children's Music Therapy, and our website comes right up, and pretty much everything we've talked about here is in written form for you guys to read and continue to learn from in that format. So, signing off. Yeah, thanks so much for learning about music therapy.